Hello.
Hi.
It's Jane, is it?
Jennifer.
Jennifer. And how do you prefer to be called? Do you prefer to be called Jennifer, Jenny, Mrs. Smith, Miss Smith?
Jennifer's fine.
That's fine. Okay, Jennifer. So what brings you here? Hi, I'm
Hi.
Dr. So-and-so, and it's Jennifer, isn't
Jennifer,
it?
yeah.
And is it alright if I call you Jennifer?
Yeah.
Or how would you prefer to be called?
No, Jennifer's fine.
And is it alright if I, do you mind if I write things down here as well when you talk and things? Is that okay?
That's
So
fine.
I can be writing
Yeah.
that. Okay, thank you. Hello, I'm Dr. So-and-so. So, it's Jennifer, is it?
Yeah.
And you're 42, is that right?
Yeah.
So, I'm Dr. So-and-so, as I said. I'm new to this practice. I'm taking on new patients at the moment. So if you'd like to join my practice, that would be excellent. I'd be really happy for you to come and join my practice, because I understand your former doctor has, well, he's not here anymore. I don't know whether he's resigned or whether he died. But anyway, I'm taking on new patients, so I'm very happy to have you on board. So what brings you in? Hello there.
Hi.
I'm Dr. How I hope it's done. So what brings you in?
I need some more morphine pills.
Okay. So, how can I help you?
Well, I need some more morphine pills. Cause,
Okay, so morphine pills. Have you got a headache, back pain,
No, I've been prescribed.
arthritis,
No, I've
headaches?
been prescribed.
You've had an injury at work?
No, I've been had a diagnosis of ovarian cancer.
So what brings you here?
Well, I need some more of my morphine pills. I've run out.
So just before you go any further, I just want to make some things sort of obvious to you, if that's okay. So you realise that morphine pills are narcotics,
Yeah.
and you know that the college is really making an effort to get people off narcotics, because there's a lot of narcotic deaths, particularly in PC, which is where I practice. So we kind of frown upon narcotic use, so we're really desperately keen, and this is all to help you, because I'm here to help you. We're really keen that we reduce narcotics, because we think it makes you much healthier. And you don't take a sleeping pill as well, do you?
No.
Because that combination is really, really bad. So so I just thought I'd put that out there, just so that so there's no, this is just to clarify expectations for you, that's all. So what are you taking the morphine pills for? Because you are very young to be taking morphine.
Well, I've been diagnosed with ovarian cancer.
What brings you in?
I need some more morphine pills.
Okay. Morphine pills. So tell me about that. What are you using the morphine pills for?
Well, I've got ovarian cancer, and I'm
Wow.
waiting for surgery.
I'm really sorry to hear that. That's wow. That's must be terrible news. Is this new news for you, or have you known about this for a while?
No, it's just it's fairly recent, and yeah, quite a surprise.
So the morphine pills are because you're having pain.
Yeah, the oncologist said that it would help just in the meantime till the surgery.
So what surgery is being planned?
We're hoping that with the surgeon can debulk and hopefully take out most of the cancer, but I'm not quite sure what actually the ultimate treatment might be.
Okay. Wow. I am really sorry to hear that. Just trying to understand the morphine pills. So who gave you the morphine pills to begin with?
It was the oncologist I was referred to.
Okay. And do you know the strength of the pills that you were given, or frequency?
I'm just taking like a couple in the morning, and then a couple at lunchtime, a couple in the evening, and he just said to, if that helps with the pain, then that's the best thing I can do.
And is that controlling the pain?
Yeah, I think it just, I'm not really in pain, so I'm just nervous that I'm not going to have enough pills left.
And have you increased the number of pills, or has the number of pills you've taken changed?
No, I've kind of stayed with what he's recommended that I start with.
And did you try anything else before those pills? Anything like, say, Tylenol or Advil, Aleve, anti-inflammatory pills?
No, I just kind of followed the advice I was given.
And what about things like over-the-counter medication, any herbal medication, anything recommended by friends? Just that you.
No, I'm really hanging out for the surgery is what's going to kind of make it better.
And are you, are you using anything else? Because when you have pain like this, it's not unusual to say to maybe help sleep with alcohol, or even people may use recreational substances like marijuana. Is that something that you've thought about, or?
No, it's not. It wouldn't. That wouldn't really work for me. I just followed the advice that I was given, the medical advice, to say that this would be a good way of controlling the pain.
Yeah.
Until we have the date for surgery.
And I've not really asked, whereabouts is the pain as well?
It's just kind of like lower abdomen, this side, like dull pain that I'm aware of.
And there all the time?
Yeah.
Does anything make it worse? Anything make it better?
No, not really. I mean, I'm obviously aware that I'm not well, and I'm that treatment's coming, so I'm just trying to get to be as comfortable as possible until till the surgery's due.
And just talking about you, just getting to know you a little bit more. Tell me about family. Are you in a relationship?
Oh yeah, I'm married. Yeah. No, my husband George. It's been a shock for everybody, but we're just trying to work through it and remain optimistic, hoping that the surgery is going to be is going to do the trick.
And how is that relationship as well?
Well, it's a shock, but he's very supportive, and yeah, we've talked about it, and neither of us know really what it's going to be like, so we're just sort of like waiting for the follow-up, and then maybe have a chance to discuss things and afterwards a little bit more, and when we get a better idea of what we're really dealing with.
And George is a support for you, you'd say, then, your husband? Yeah. And just to clarify, George is a man?
Yep.
Yeah. Okay, just, it's one of those things I just want to clarify. I don't want to embarrass myself by saying something that I regret afterwards. Any medications that you take?
No, not really, just the pills that I've been prescribed now.
Okay. I'm just going to write these down. And anything over the counter?
Oh, and another thing actually.
Okay, just finish that question for me. Anything that you take over the counter?
No.
Okay. So sorry I interrupted. What was the other thing?
Well, our son who's 16, he's not really behaving the same. We've been contacted by school to say that he's not concentrating in class, and he's not been handing things in.
Do you think he's taking drugs? Because it's not unusual for teenagers, they do experiments. So it could be drugs, it could be alcohol he's taking.
Well, it's
it could be that he's smoking marijuana.
It's not like him, but it's hard to say given the situation, and maybe we're not talking.
So you don't think it's that he's doing? Do you think he's, how do you think I can help? Would you expect that, what are your expectations from this meeting?
I don't know really, I just thought that that's something else which is...
And how do you feel about him doing these things? Because I'm here to help. I just want to say I'm here to help.
But I don't really know what's going on with him.
So you have no idea what's happening?
I mean, he's
and does he function normally?
He's a great kid, and I don't really know what's the matter with him at the moment.
And he functions normally?
He's 16 and he's a teenager and...
Okay. So I'm just going back through the list again. So have you had any surgeries?
No.
And have you got any medical problems that I should know about?
Well, no, just this is the one that's come to light. I've not really had any problems. Just
Okay. Okay. We're talking about medication and whether you'd had surgeries.
Well, I'm concerned about my son actually.
Oh, how old is your son?
16.
Is he sick? Has he got a sore throat? Has he got a headache? Is it teenage issues?
Well, he's not really... I don't really know what's going on, but the school have contacted us to say that he's not concentrating in class and he's not handing things in, so I'm just really worried about him.
So do you think he could just be lazy then? Do you think, I suppose he could be doing substances, eh?
Well, that's very unusual. That's not what I think, no.
Yeah, so any surgeries?
No.
Any allergies?
No.
Okay.
Well, there is I'm kind of worried about my son, actually.
Now, if you could just hold that, I just want to finish off just talking about these other things, and then we're going to come back to that if that's okay. So, any allergies? Let me just think here. And no surgeries, and how's the finances?
Well, I'm not working at the moment.
So, finances are not good at the moment?
Well, I'm okay for a bit. You have 3 minutes left.
Oh, okay. I think there's two problems. You obviously have ovarian cancer, and you've got issues with your son. We're going to refill. I'm here to help you. And we're going to refill the medication for you. Do you think there's anything you haven't told me yet that could be really helpful to the way we're going to manage things? No. Okay, thank you for that. So yeah, we've got the we're going to refill the morphine, and we're going to have a chat with your son, because he's not feeling so good at the moment. Yeah, I think that's everything. Thank you.
You have 3 minutes left.
Okay, thank you. So the way I see this, it seems that there are two really major problems for you, sadly. One is this new diagnosis of ovarian cancer, which we're using painkillers for because of the pain that seems to be doing something for you at the moment. And then we can get you back, I hope, after the surgery, and then we can review that medication dose, because we don't really want you to be on strong medication if you don't need it.
Mm-hmm.
The other thing seems to be with your son Jesse, that we've got concerns that maybe this news of this new terrible news is affecting maybe more adversely than we think.
Mm-hmm.
We're going to get him in and have a chat. So that seems to be the two things. Does that seem about right?
Yeah.
And so thinking about how we're going to manage that, have you had any thoughts how we could possibly manage either of those problems? Well, let's a little bit obtuse. Let's think about with the pain management. So it seems reasonable, I think, that we agree that we're going to continue these pills till the surgery date, and then you and I are going to meet afterwards, and we'll see where we are at that stage, hopefully with a view to maybe reduce some of the medication.
Yeah.
Does that sound reasonable?
Yeah.
You've no desire to sort of continue on those pills, not if you don't need to, because we talked about the side effects with the constipation, the tiredness, fatigue, and that you can get used to that medication. And sadly there may come a time when we actually need to use that medication, and we want you to be able to react to it.
Mm-hmm.
The other problem is the more complicated one, I think, is with your son. Have you any thoughts of how we could manage this?
Well, I'm not sure what to do really, whether we're not talking to him enough, or whether we shouldn't talk to him, or whether it's teenage.
So I think we get him in, and I think one of the things, we'll have a chat with him. Well, we can explore together, and you can bring your husband as well if you think that would be helpful.
Mm-hmm.
Just to see how he feels about you, and whether he there's anything he wants to express about that. I think we should probably, if we can, maybe do a physical, just to be checking, just for simple things like mono, just in case he's developed something like that. Maybe we could think about blood tests just to make sure he's not got a thyroid issue, which is just coincidental, or that he's anemic and he's lacking energy because of that. So I think we should just maybe do a few things like that as well. We'd probably need to have a serious conversation with him about substances, to make sure he's not, with his stress, maybe using marijuana or drugs, alcohol, things like that again could be adversely affecting him. And maybe even think about counselling for him as well. I don't know, what do you think? Sound?
Well, we can try. I'll talk to him later.
Sound reasonable? Is there anything that you want to add to that maybe we could think about differently?
No.
Okay, thank you.